All right, right now, Governor Larry Hogan is addressing Marylanders and how we're preparing for a possible outbreak of the coronavirus here.
Yes, he's having a news conference in Annapolis. Let's go there now to listen in.
As well as Executive Director of the Maryland Emergency Management Agency, MEMA, Russ Strickland, Executive Director of Maryland Aviation Administration, which oversees BWI, Ricky Smith, and our Acting Superintendent of Maryland State Police, Jerry Jones. At this time, I'd like to hand this over to the Governor, Governor Larry Hogan.
Thank you. Well, good afternoon. We are here at the State Emergency Operations Center of the Maryland Emergency Management Agency, located at Camp Frederick, in order to provide Marylanders with a number of important updates regarding COVID-19, the novel coronavirus, which has become a major public health issue around the globe. The state of Maryland has been taking this issue extremely seriously. A month ago, at my direction, our administration initiated actions for the preparation and mobilization of all necessary resources in order to address the coronavirus. State health officials immediately began working with the CDC, NIH, and other federal agencies and officials, and with local health departments, hospitals, and others to activate an aggressive and collaborative response. 3 weeks ago, I convened and led a meeting of top federal officials and nearly all of America's governors on the coronavirus in Washington, where we received a detailed briefing from CDC Director Dr. Robert Redfield, Ken Cuccinelli, the Acting Deputy Secretary of the Department of Homeland Security, Dr. Robert Kadlec, the Assistant Secretary for Preparedness and Response at the Department of Health and Human Services, Dr. Anthony Fauci, the Director of the National Institute of Allergy and Infectious Diseases at NIH, and Dr. Jay Butler, the Deputy Director for Infectious Diseases at the CDC. And yesterday, I met with Brigadier General Michael Talley, the Commanding General of the U.S. Army Research and Development Command at Fort Detrick. Just a few moments ago, I held a cabinet meeting with top officials in our state government to review the latest up-to-the-minute efforts in our ongoing preparation for and coordinated response to the coronavirus. And I was just a few minutes late for this press conference because I just got off the phone with Vice President Mike Pence, who is leading the response at the federal level. And I was very pleased that the President made the decision yesterday that Vice President Pence will be leading this effort at the federal level. As a former governor, Vice President Pence understands the importance of a coordinated response, and we agreed to keep in close contact in the weeks ahead. Earlier today, 2 Marylanders who recently traveled to China met the CDC criteria and are currently being tested for the coronavirus. Our administration's first and most important responsibility is keeping Marylanders safe. And while there is not yet any immediate public health emergency here in our state, let me repeat that. There is no immediate public health emergency here in Maryland. Based on the latest guidance from the CDC and our federal partners, we want our citizens to know that all levels of government are working together proactively and taking every possible precaution to respond to potential threats of public health. In just a few moments, our Deputy Secretary for Public Health Services, Fran Phillips, will provide a more detailed update. But I'd like to talk about some of the important steps that are already being taken. The Maryland Department of Health has activated public health surveillance and clinical guidance protocols, mobilizing our capabilities in every jurisdiction across the state. Top health officials are participating on a daily basis with the CDC, in daily briefings with the CDC and federal authorities, and holding regular briefings with local health departments, physicians, nurse practitioners, pharmacists, and universities. And our health department has worked with local hospitals, which have all developed comprehensive hospital surge plans, which will be activated if and when it becomes necessary. The Maryland Department of Health, in coordination with our Department of Education, has been in communication and has provided guidance to local school superintendents and school officials. The team here at the Maryland Emergency Management Agency is coordinating with local emergency managers in jurisdictions all across the state, and will be bringing together leaders from all state agencies for a comprehensive tabletop exercise. I will be convening my entire cabinet tomorrow for another detailed briefing. State health officials will be briefing members of the legislature, the comptroller, the attorney general, and the treasurer tomorrow, and our coordinated statewide preparedness efforts. And our administration is going to submit a supplemental budget, which includes $10 million for emergency coronavirus preparedness expenses. I want to assure Marylanders that our state is taking every precaution when it comes to the coronavirus, because our highest priority is keeping our residents safe. While we are hoping for the best, we are also actively planning for the worst. As the CDC warned a few days ago, local schools and daycares should be prepared with contingency plans for potential long-term closures. Local communities and cities should be prepared to modify, postpone, or cancel mass gatherings, and local businesses should be ready for office closures that require their employees to work from home. CDC officials warn that while this situation may seem overwhelming and that there may be disruption to everyday life, may be severe, these are the kinds of things that people should start planning for right now. We are going to continue to track this. We will be receiving almost constant, up-to-the-minute information, and we will continue to coordinate all available resources in the days and the weeks ahead. The public should be assured that our state's preparedness builds on decades of planning, experience, and expertise, which has been gained by previous and ongoing public health events, including the flu type A and B, which is what most people would call the normal flu, which has already resulted in the hospitalization of 3,000 Marylanders, and which has already taken 40 Maryland lives just during this current flu season. We're very fortunate that Maryland has some of the top health research facilities in the world, and I'm confident in our state's ability to respond effectively to potential cases of coronavirus and to be a leader in developing treatments and perhaps even a vaccine. I would encourage all Marylanders not to panic, but to take this seriously and to continue to stay informed. We would encourage you to visit health.maryland.gov/coronavirus. Residents can also dial 211 to connect with a helpline representative effectively immediately to get information and community resources on the coronavirus. And at this time, I'm going to turn the floor over to Deputy Secretary for Public Health Services.
Well, you were just listening to Governor Larry Hogan and others addressing what Maryland is doing to prepare for a possible coronavirus outbreak. We, of course, will continue to monitor that news conference and bring you more coming up new at 5.